If you're looking to maximize your Medicare benefits, then you have to ask yourself this one important question that could really change so much about the way that you receive healthcare and your finances. Here's the question for you. What do I qualify for? It's probably the most asked question that we've been asked at Medicare Pro over the last decade. Hi, I'm Randall Garcia. I'm the owner of Medicare Pro. We're a licensed independent insurance agency, and I hope that you find the information in this video to your liking. Subscribe, like, comment if you have questions, and we'd love to help you in any way that we can. Let's dig into today's video. What do I qualify for? It's a very important question that we get asked in Medicare Pro. Well, I'll first answer that there's income-related programs that I'd like to see if you qualify for. I'm about to give you a breakdown of some of the thresholds and income limits that may determine what you qualify for. And so I'd take out a pen, a paper, and maybe you start doing the math, maybe pause this video to see what your gross monthly income is, because when we look at these income-related limits, the first thing that we need to determine is what is your total monthly income. Because if you're going to be eligible for something, let's say the Medicare Savings Program or extra help, we'll talk about what those mean in a second, then they're going to take your gross or total monthly income. So for an individual, they're going to take your gross income, whether it's Social Security, whether it's maybe compensation or paychecks that you get from your work. If you have any other forms of income, total it all up as an individual. And there's going to be individual income thresholds, and there's going to be thresholds that couples need to meet. And so the couple threshold is always an interesting conversation. Usually when we speak about adding the couple's income together, we talk about married couples or common law married couples. According to Social Security, that is the measure that they use. And when you add up your total gross income, then it will tell us if you qualify for one of these programs. The first program we're going to talk about is the Medicare Savings Program. So you may be familiar if you've been on Medicare for a while, especially in 2024 when this video is being recorded. Medicare has a standard monthly premium of $174.70 a month. And you may see commercials or advertisements that actually tell you that you could get that reduced. And most of them say you may be able to get the $174.70 a month back into your Social Security check. That is true for some individuals, but you got to be very careful who you talk to and what phone numbers you call, because a lot of times those are used as marketing tactics to get you to call a number, and you might end up with a sales agent that's simply just trying to switch your plan. But the program is real. It's called the Medicare Savings Program, and it has income and asset thresholds that we're about to discuss. There's another program called the Extra Help Program, and this helps with your prescription drug premiums, your deductibles, and copays. So I have a client that was paying $47 a month for their prescriptions. I have another client that was paying $100 a month for their prescriptions. Both of these clients ended up qualifying for Extra Help. I helped them fill out the application, and now each of them, they're not paying $47 or $100 a month. They're just paying $3, $4 a month, and in some cases $7 or $8 a month, because they're getting the Extra Help subsidy, a prescription drug discount program through Social Security. And let's talk about what that income limit is. That's the first one we'll talk about, Extra Help. We also call it the Low Income Subsidy, the LIS program. I know there's a lot of names for these things, which is why it can be very, very confusing. For a single person, you have to make less than $1,903 in income, and you have to have less than $17,220 in assets. For a couple, if you did the math, you have to make less than $25,75, and you have to have less than $34,360 in assets. And if you're below these numbers, then you're going to get help with your prescriptions by filling out the extra help application through SSA.gov. That's the Social Security Administration.gov, SSA.gov. Right from the drop-down menu, you can actually click on a button that says Apply for Extra Help. I prefer the online application, and it's a real easy way to see if you qualify. Fill it out, and you may just be getting a prescription drug discount a few weeks later. Sometimes it takes a few weeks, sometimes it takes a couple months, but hopefully if you're under that, it'll kick in pretty quickly there. The next program is called QI. So the QI individuals also get the extra help program. And they also get their Part B premium reduced to zero. So they're getting the drug discount, and you remember the $174.70, the standard Medicare Part B premium? Well, now that you're not paying that anymore, right? Because QI is kicked in, and it's providing you the Medicare Savings Program, where it pays down the Part B premium to zero. There are the income limits for single, $1,715 for a single person. For a couple, it's $2,320. And so you want to make sure that you're under those limits, and that way you can hopefully get that money reduced for you, that $174.70. Here's another program. It's called, it's called SLMB. SLMB is a program that pays the Part A and Part B premium. So every level that we go up, number one, it still includes the drug discount programs, but now you're adding, it goes from LIS to QI to SLMB, and you're getting closer to the next category, which is Medicaid, but we're still in the SLMB category, where the Part A and the Part B premium are now paid by SLMB. But you can see the income limits change again, and now you have to make less than $1,526 as a single person, and income less than $2,064, and there are your asset limits to see if you qualify. And then last but not least, we have QMB. Okay, in Texas, a lot of times we just say that's Medicaid, right? They have Medicare and they have Medicaid, or they have Medicare and they have QMB. A qualified Medicare beneficiary, it pays the Medicare Part A, Part B premium, it pays coinsurance and deductibles. And so, the QMB a lot of times will pay down your doctor copays, your specialist copays, hospital copays, surgery copays. And so, therefore, most people will get that paid down to zero, where you no longer have a patient responsibility. That's what QMB is designed to do. Now, the income limits are now, again, lower. For a single person, it's $1,275. For a couple, it's $1,724. Remember, it's the gross monthly income. I've helped a lot of people over the last 11 years qualify for all of these programs. And let me tell you, sometimes it makes a difference of hundreds of dollars of savings a month, but I have way too many stories to count of people who are saving thousands upon thousands upon thousands of dollars every single year because they applied for one of these programs and qualified based on their income. And so QMB, they also, a lot of these people will qualify for what we call a dual special needs plan. And so Medicare Pro, we help people get into these dual special needs plans, or we call them D-SNP, and dual means two. So you have Medicare and you have QMB, Medicare and Medicaid. And so combining those into a dual plan or a D-SNP plan, a lot of times will give you even more benefits, things like dental and vision and hearing. In some areas, there's healthy groceries and over-the-counter credits. It depends on your zip code and where you live. But there's a lot of these bonuses, these extra benefits that are added into your plan at no additional cost that will end up saving you even more money than the QMB itself. So these are the income limits. If you're below that, I would suggest giving us a call at Medicare Pro so we can help you. But there's also other programs and plans, because remember, the big question it is, what do I qualify for? Well, we have to talk about the last thing is chronic condition related programs. So there's a few of them. They're called C-SNP plans, where they're Medicare Advantage plans that are catered towards individuals with certain chronic conditions. And these C-SNP plans, they're different by zip code. Common C-SNP plans are plans that cater towards special needs or special chronic conditions like diabetes, chronic heart conditions, and even in some areas, there are C-SNP plans for lung conditions such as COPD and more. Depending on where you live, there might be a C-SNP plan in your area that we can look up to make sure that you're qualifying for the most benefits. So one of the things that we love about helping our customers is we're not only trying to help them find the right plan that fits their doctors, that fits their prescriptions, but we're also trying to find a plan that fits their budget, and we're helping them qualify for these plans and for these programs that will help people save even more money. And the cool thing about all of this is for you, it might not be cool, is that it can be very, very confusing. And so what you need is a Medicare professional that can help navigate this confusing world, get the right plan, the right doctor, the right programs, do it all from start to finish, from A to Z, that an agent can hold your hand through the entire process and be your Medicare professional. Well, that's what Medicare Pro does. So if you have questions or comments, if you need an agent, if you want to schedule a one-on-one session, I encourage you to go to our website, www.medicarepro.online, and we'd love to set up a one-on-one consultation with you to go over everything. We have no cost for our services, and there's no obligation to enroll. I hope that this information served you well, and I hope that you have an amazing day.